We have another question we received earlier, this one from Eileen. She asks, how will I know whether my treatment is working?
It's a really good question. So I think, for patients who have symptoms from their cancer, they often will know the drug is working because their symptoms improve. Say if you have lung metastases and you are short of breath and your shortness of breath gets better, that's a really good sign that the treatment is working. I would say that often what we are doing, and it depends a little bit on the regimen and, what the patient is getting and how often they're coming in. But we're checking labs as well. And sometimes there are lab abnormalities when a patient is diagnosed with metastatic cancer that can then improve over time. So, for example, if someone has a heavy burden of bone involvement with breast cancer, there's a lab value called the alkaline phosphatase that will often be elevated. And if that starts elevated and comes down, that's a really good sign. And similarly, there are liver function tests that we check. And if a patient has liver metastases, we often will see those come down if a patient is responding. There are also what we call tumor markers that we can check in patients with metastatic breast cancer. Those would be like proteins in the blood, basically, that can be made by the breast cancer in abundance. Those are called CA2729 and CA15-3. Some doctors check both of them. Some will just check one, depending on which one their laboratory at their institution is running. But typically, I will check those at diagnosis of metastatic disease. And then if it's elevated, I know it's a good marker to follow for my patient. And then I'll follow that, monthly or every 3 weeks, depending on when the patient is coming in to see me. And if I see that marker start to go down, it's not an absolute, but it can be a good early indicator of improvement with the treatment. Mm-hmm. And then, I think it varies also a little bit from practice to practice and based on patient preference. But often there will be scans done when a patient is initially diagnosed to kind of determine the extent of the disease. So usually like a CT scan of the chest and the abdomen and the pelvis, or a PET scan, which some of you may have heard of. Either one of those is good. And that can be done, about every 12 weeks, usually in the beginning, to make sure a patient's responding. And once you feel confident that they are, those can be done less frequently. So I would say the scans and the lab work and then just the patient's overall condition are usually the way that we look to see, are we having a response or not?